According to Professor Spiransky, 1928, at the beginning of the 20th century, 92% of Russian women used breastfeeding. For example, in 1926, 98% used breastfeeding. So famous Russian artist Zinaida Serebrякova. Next slide. You can see in this slide two pictures. From the right, Russian noblewoman use nurse breastfeeding for her child. It's usual. It was normally in Russian Empire before revolution. On the picture from the left, you can see Russian Tsar, Russian Emperor Nicholas II, and his wife, Empress Alexandra Fedorovna. She also used breastfeeding for her oldest daughter, Olga. This is against norm in the Russian nobility at that time. Next slide, please. The data on the study of the health of foreigners in the Simbirsk province, Buinsky County, Chuvash, Mordovian and Tatar population collected by measuring height, chest, circumference, lung capacity, and weight. These data from Dr. Medicine dissertation by Ivan Blagovidov, St. Petersburg, 1886. The height infant mortality among the Orthodox population is due solely to mortality from childhood diarrhea, and the mortality of Tatar children under 1 year old is comparatively even more insignificant and turns out to be 3 times less than among infant Orthodox. The Tatar woman, by virtue of the rules of the Quran, feed their infants exclusively with breasts, while Russian children abundant with shaving nipples fade away from artificial hunger from gradual exhaustion. Next slide. You can see painting by artist Shubina. Our children shouldn't die from diarrhea. Only breastfeed until 6 months old. It was ruled even 50 years before the World Health Organization recommendations. Next slide, please. You can see divisions at our Department of Nutrition Technologies and Breastfeeding at Kulakov National Medical Research Center for Obstetrics, Gynecology, and Perinatology, led by academician Suhir. First division of breastfeeding support and human milk research. Another division of human milk substitutes. Next, please. The assistance is provided at all necessary stages. More than 8,000 women receive practical lactation care every year. At the stages of pregnancy, postpartum, and follow-up. Next, please. You can see pictures of assistance in attachment to the breast of premature and sick newborns, transportation of colostrum. Next, please. At least 70% of mothers in the first days, even after natural childbirth, need to help of a specialist. Next, please. The purpose of the study was to determine the prevalence of breast feeding during the first year of life in the group of mothers of full-term babies who have difficulty in putting the baby to the breast and low score at the large scale. Methods. Prospective cohort study from 2020 to 2022. Consultation with a breastfeeding specialist at least 2-3 times. Assessment at the large scale, conducting a finger test to assess the efficiency of sucking, conducting speech therapy, massage. Teaching comfortable position for breastfeeding, decanting, and supplementing with colostrum from a syringe when it's impossible to effectively apply to the breast. Follow-up survey by phone calling at 3 and 3.6 and 9 months. Next, please. 16 mother-child dyads who temporarily needed to be supplemented with expressed colostrum due to ineffective breastfeeding. Large score was 4.07 at the first day. And after these procedures, for example, difficulties with putting baby to the breast were experienced by 100% of women. In 13 out of 18 children, 72%, ineffective was identified by performing a finger suckling. Experienced pain while breastfeeding, it was 44% of women. Cracks of abrasions of the nipples, about 22%, and 100% of women needed help from a breastfeeding specialist, 2-3 consultations. So finally, a large score at discharge became value 7.07. Next, please. Control group children under exclusively breastfeeding, 24 dyads, mother, child, large score, 7.2 at the first day. Difficulties with putting the baby to the breast were experienced by 45% of women. Experienced pain during breastfeeding, it's about 58% of women. Cracked or abraded nipples, about 37% of women. 70% of women needed the help of a breastfeeding specialist. Next, please. At this slide, you can see the first data from first paper on large scoring system. Large score, a breastfeeding charting system and documentation tool from Journal of Obstetrics, Gynecological, and Neonatal Nursing, 1994. So, components of the system: L, latch; A, audible swallowing; T, type of nipple; C, comfort, breast nipple; and H, hold. So score was from 0 to 2. Next, please. Duration of breastfeeding. You can see the main data of our study. So blue, it was control group, children with exhaustive breastfeeding in the perinatal center, Kulakov perinatal center. Brown, children from mothers with breastfeeding difficulties at the Kulakov perinatal center, and grow data with statistical data from Federal State Statistics Service from 2020. The prevalence of breastfeeding in the first year of life in the group of children was a low score at the large scale, is generally lower compared to the group of children with a high score and on exhaustive breastfeeding, but due to adequate support of breastfeeding during the first days of life, it's significantly higher than in general population, according to Rostat. This data from paper large score at discharge, a predictor of weight gain and exclusive breastfeeding at 6 weeks in term healthy babies. Large score of 7 or higher significantly increased likelihood of exclusive breastfeeding 6 weeks after discharge, and weight gain of more than 20 grams per day. So blue, so on this slide, you can see dependence of weight dynamics in the first 6 weeks of life at the large score at discharge. Blue weight gain less than 20 grams a day, and brown weight gain more than 20 grams per day. Large score 7 or higher significantly increased likelihood of exclusive breastfeeding 6 weeks after discharge, and weight gain of more than 20 grams a day. Next, please. So prior breastfeeding experience and breastfeeding counseling were statistically significantly associated with higher large scores at discharge on a multivariate statistical analysis. Next, please. So our conclusions from presented materials. Firstly, the large score is an objective tool for evaluating breastfeeding efficiency. Secondly, at least 70% of mothers require assistance in establishing breastfeeding, even those with a high score on the large scale and on breastfeeding. Thirdly, the help of a breastfeeding specialist in the form of daily support is required for mothers and children with a low large score. Moreover, it's important to teach pumping and non-sucking methods of supplementary feeding from a syringe as a temporary measure of breastfeeding support. Fourthly, large score and suckling efficiency at this discharge are improved with adequate breastfeeding support even in these infants. Fifthly, the prevalence of breastfeeding in the first year of life in the group of children with a low score at the large scale is generally lower compared to the group of children with a high score on exclusively breastfeeding. But due to adequate support of breastfeeding during the first days of life, it's significantly higher than in the general population, according to Rosstat data 2020. Next, please. Thank you for your attention. This picture painting by Vasily Spasky. Thank you very much for your attention.
Thank you very much.
Thank you so much